A Minnesota doctor is raising awareness about a common health problem for women and an alternative to the most common type of treatment. Hysterectomies are the second most common surgery for women behind C-sections. Joining us with more is Dr. Mike Cumming, head of vascular care at the Minneapolis Center for Diagnostic Imaging. Thank you so much for joining us.
Thank you for having me.
First of all, what is a uterine fibroid?
So, uterine fibroid is the most common benign non-cancerous growth in the uterus, and it's essentially a clump of muscle tissue, muscle cells, and other tissues that grow in and around the uterus. And fibroids can vary in size from as small as a grape to as big as a grapefruit.
Oh, wow. And up to 80% of women get these by age 50?
Right,
that is
by
a
age
lot.
50. So at age 30, about 30% have them, and by age 50, over 3/4.
Are there symptoms, or is this something your doctor detects?
The majority of fibroids actually don't cause any symptoms.
Okay.
They can be found during a routine physical examination, but about 30% of females do have symptoms from their fibroids.
And if they do, what are those symptoms?
So they kind of fall into two different categories. Those related to bleeding,
Okay.
so you can have painful, heavy periods that drag on. And then the other category of symptoms are bulk-related symptoms, so where they have problems related to the size of the fibroids, where they push on the pelvic or abdominal organs.
Okay. And that's obviously can, down the road, cause some pretty serious problems.
Right, so you can have problems with bloating, back pain, painful intercourse, incontinence, constipation.
Okay. So you don't perform hysterectomies, but you do an alternative to hysterectomies.
Right, so we do a procedure called Uterine Fibroid Embolization, or as we like to call it, UFE.
Okay.
And this procedure's been around for about 20 years and is being increasingly utilized to treat fibroids in women that would like to go a uterine sparing procedure.
And so what are the pros other than being able to keep your uterus, obviously?
Well, there's certainly great advantages to keeping your uterus, but the pros, in terms of the procedure itself, it's very safe, works very well, and it's an outpatient procedure. And most women will get back to their active daily living within a week or so of the procedure versus 4 to 6 weeks for a hysterectomy.
Oh, wow. And you're usually outpatient. You usually aren't even spending the night in the hospital.
Right. This is typically someone in our clinic. They come in the morning and they're gone by 1, 2 o'clock in the afternoon.
What about the cons?
Well, the cons of the procedure is you do leave your uterus in place, and so you do have the opportunity to develop more fibroids with time. So a small percentage of women will need a second procedure. And then sometimes if the fibroids are really big, they don't shrink quite enough to get symptom relief. So a small percentage of women will need a hysterectomy afterwards.
And instead of removing it like you are with a hysterectomy, you're shrinking the fibroids?
Right. So what we do is we guide a tiny plastic tube, or what we call a catheter, into the arteries that supply the fibroids, and then we inject very small particles which go into the fibroids and block off the blood flow, causing the fibroids to die and then shrink down.
How long does that take?
The shrinkage can take place up to about a year until they completely shrink down. So patients that have bleeding problems, the bleeding problems get better very quickly, whereas if they have bulk symptoms, it tends to take a little bit longer.
Okay, so you have to weigh the pros and cons there, whether it's for you or not, whether you need immediate relief or whether it's something that can take a few months to rectify.
The important thing is being able to talk to the patient and making sure they understand all the different alternatives that they have so that we can make the best decision, we can help them make the best decision.
Is this also for women who are past the point where they want to have children?
Typically, yes, we do. The procedure, we try and perform the procedure only in patients that are past where they want to have children anymore. There's not great data in terms of doing this procedure prior in patients that still wish to become pregnant.
Okay. Is this the main alternative to a hysterectomy, or are there others?
Absolutely. There are other options. One of the procedures that is done is called a myomectomy, where you go in and actually cut the fibroid out, and that works well in patients that have a single fibroid or a single fibroid that needs to be treated.
All right. Well, thank you so much, doctor. This
You're
is very
welcome.
interesting. If people want to find out more, if they're curious, where should they
They'd be
go?
welcome to come to our website, cdivascular.com, where they can read a lot of information about uterine fibroid embolization and how the procedure works and what to expect.
And of course, like with anything medical, good to talk to your doctor first and get the right information, start asking questions before you make any big decisions. All right.
Great.
Thank you, doctor. We
Great.
appreciate it. Thanks for coming in.
Great. Thank you very much.